Hello, this is Dr. Farley. In today's blog, I'm going to be going over with you a research article that came out of movement disorders in 2018, and it was the title is Autonomic Dysfunction, Parkinson's disease. And basically what they found is that there's a lot of autonomic dysfunction that starts, and autonomic dysfunction means that the autonomic part of the nervous system is not functioning properly. And we know that we usually have dysautonomia, which means it's not working properly, way before we get motor problems. So there's the autonomic nervous system, and then there's the somatic nervous system. The somatic nervous system would be the tremors and the stiffness and the movement and the gait abnormalities. But the autonomics usually happen first. 90% of the output of the brain goes to the autonomics. So we can measure this, and we do measure this in my office here, and we can track this over time to see the autonomics, what your current level of function is, and then track it over time to see if we're moving in the right direction or not. Autonomic symptoms can be gastrointestinal problems, sexual issues, genitourinary issues, sweating issues, thermoregulatory, which is temperature issues, cardiovascular, heart palpitations, irregular heartbeats, and then even Ragland's test could be positive, or what's called orthostatic hypotension. When you stand up, you feel dizzy. And those are also major reasons to also have a fall. There's a 20%, emergency room and hospital visits and other medical visits are normal to people that have Parkinson's disease. So the question is, you may not be able to get rid of these completely, but if we can decrease this and improve autonomics, is a major player in someone's overall health. 20% of these patients will get worse over 12 months, and anything better than that is an improvement. All of my patients are getting improved autonomic function. It's rare that they're not, and if they're not, it's usually because they're not doing something properly, especially with the foods, and then we normally can tighten it up and go back and retest again, and we see the numbers go up. Your symptoms are not accurate, meaning we can't go by your symptoms. We have to do some measuring here. So what we do basically is, one of the measurements that we do a lot of blood pressure regulation changes. We also look at we measure through heart rate variability to measure your autonomic nervous system, and we get 21 different parameters that my machine measures. And then from there, we can take a look at how autonomic function is and be able to track you over time, if your case was to qualify. What else do I want to go over here? Yeah, so I'll give you a little bit more issues here. Gastrointestinal autonomic issues were reported in 55% of the patients. Urinary or sexual issues were reported in 63% of the patients. Thermoregulatory, 35% of the patients. Cardiovascular abnormalities, 18% of the patients. And pupilomotor, 18% of the patients. And again, also the orthostatic hypotension was a very, very common incident. 31% of the patients. Dysautonomia usually occurs early in Parkinson's disease, which means if I was measuring someone and you wanted to know what your risk is for future neurodegeneration, if we see the autonomic nervous system breaking down, it's a key indicator of future neurodegeneration and a higher risk of Parkinson's. Dysautonomia will show up 3 times more than somatic changes like tremors and stiffness, and 8 times before cognitive deficits show up. 50% of these patients with dysautonomia have no symptoms until there's 85% damage. Remember again, by the time you get symptoms, there's 85% damage happening across the board. So we have to have massive breakdown, cells dying and dying and dying, and then finally we get symptoms. So the symptoms are not the beginning. The symptoms are basically the end of the system being able to adapt, and then we fire off symptoms. So if we can get in there and measure function, which we can, then over a time frame we can track you better over time. We also can know, we also can tell you too sometimes how medications are working, because when people change medications, of course it's going to change your autonomics. And we have also seen that some medications work better than others, meaning that there's going to be an improvement in the autonomic function or a downgrade in the autonomic function. So there's a way to track this over time, and this is one of the things that we do to be able to monitor you as a Parkinson's patient or a neurodegenerative patient, and be able to see what's going on with your autonomic nervous system. And again, 90% of the autonomics, 90% of the output of the brain go to the autonomics, and 90% of your autonomics should be in a parasympathetic rest and relax type balance, and only 10% stress and sympathetic balance. So thank you. If you have any questions, please give the office a call.